Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to this week's episode of Open Clinic with Dr. Chudi. Now, today's topic is a topic I want virtually everybody in the community to pay attention to. So, we're going to talk about hypertension or high blood pressure. Both of them are the same thing. Now, there are so many misconceptions out there. Few days ago, we watched a video of a lady that came openly and boldly and completely misled a lot of people. So there are so many things you might think you know. There are so many ways you might understand hypertension, which might actually not be true. So there are so many things they might have told you, thinking, worrying. And some parents are very good in using emotional blackmail on their kids. So I'm sure you've heard your parents tell you, oh, this child is trying to give me hypertension. Or maybe you didn't marry on time or you didn't do what they wanted you to do. And they kind of use emotions to tell you, oh, the reason why they have stroke today or the reason why they have heart attack is because you gave them hypertension. Now, it's important we understand correctly the concept of hypertension. So that's what I'm going to do this evening. So please, when you come in, make yourself comfortable. I'm going to use the first part of my presentation to talk about hypertension, what you need to know about hypertension. Then I'm going to talk about the management. Then afterwards, you will have an opportunity to ask your questions. In our community, we look at issues that border on public health. So hypertension, it's a condition that has a very high public health importance. There are so many people that might have hypertension right now, they wouldn't even know. So the concept of silent killer, it's what is actually of public health importance. So it's possible that you have hypertension as we talk. It's possible that your dad had hypertension, your mom, your grandmom, your grandfather, your siblings, and it's familial. So if your parents had hypertension, the possibility you will have hypertension is very high, depending on your lifestyle. So there are a couple of things you can modify based on what you inherit from your parents, then you can try better. But depending on your lifestyle, depending on the kind of things you do, you might actually help some of the things you got from your parents to manifest. So some people can pick cancer genes from their parents, diabetes, hypertension, and a couple of other problems. Now, if you modify your lifestyle, you can overcome those health challenges. But if you live carelessly, you can actually fine tune and make them come early. Now, in talking about hypertension, I want us to focus on concepts. So there are important concepts I want you to focus on. Number one, I want you to focus on the heart. The heart is very important anytime we're talking about hypertension. So the heart is an organ I want you to focus on. Then I also want you to focus on blood vessels. Then I also want you to focus on arteries and ventricles. So the heart, blood vessels, arteries, and ventricles. So here's the deal. Arteries are major blood vessels that actually take blood away from the heart. So the major role of arteries, which is a type of blood vessel. So blood vessels are vessels that carry blood. Just like you have vessels that carry petroleum products. So blood vessels are vessels that carry blood. So there are some vessels that will take blood back to the heart, and there are some vessels that will collect blood out of the heart. So arteries are those type of blood vessels that will take blood away from the heart. Now, when we talk about the heart, I want you to focus on the ventricles. So the heart is divided into four chambers. But the chamber we're concerned with this afternoon, it's the ventricles. So your ventricles are the chambers that will contract. So when your ventricles contract, they will push the blood away from the heart. When it pushes the blood away from the heart, it's going to go to the arteries. So there are major arteries in your body that actually collects the blood, that when your heart is contracting, the blood that will leave your heart will go into the arteries. So what will the arteries do when they get the blood? They will distribute it to the whole body. The reason why I'm talking to you this afternoon without being there is because I have blood in my system, because my arteries are working properly. So when the arteries collect the blood from the heart, they will distribute it to all the parts of the body, to the tissues, to the organs. The major role of blood is to supply oxygen. So the reason why we function properly is because of oxygen. So when the arteries collect the blood, so I wanted to focus on the sequence. The heart is going to contract. The ventricles are going to contract. The ventricles are going to pump the blood out of the heart. The arteries are going to collect that blood. Now, the problem starts in the pressure inside the arteries. So when we talk about hypertension, we are actually talking about the tension inside the walls of the arteries. Now, normally, the pressure inside the walls is supposed to be high so that it will help to expel the blood. So if we don't have enough pressure, like if you go to put gas in your car, when you're pumping, there should be pressure in that blood vessel. There should be pressure in that hose so that gas can enter your car. This is exactly what happens in the arteries. So we expect the pressure in the arteries to be high and forceful so that blood can come out. Now, the problem starts when the pressure inside the artery is excessively high. So when we talk about high blood pressure, we are actually focusing on numbers. So I want you to generally pay attention to number 140 and 90. So I don't know the last time you measured your blood pressure. There are two numbers you need to be conversant with. The number on top, it's called the systolic. The number below is called the diastolic. Now, the number on top is the pressure inside the arteries when the heart is contracting. So if you pay attention, if you want to know if you're still alive, I want you to place your hand below your left breast. If you feel the sensation below your left breast, that's your heart. That's the apex of your heart. Now your heart contracts and relaxes. So when we measure the pressure in the arteries, when your heart is contracting, that particular reading is called the systolic. When your heart relaxes between contractions, when we measure the blood pressure in the arteries, what we will get is what we call diastolic. So anytime you're measuring your blood pressure, we are looking at the number on top, which is called the systolic, and the number below, which is called the diastolic. Now, if you have consistent number in the range of 140 in the number on top, which is the systolic. So if I check your blood pressure last 2 months and I got 140, one reading of your blood pressure is not hypertension. But if I check last month and I got 140 over 100, then I check again, this month, and I got 150 over 120. That's like a steady kind of trend. Now, if it continues in January and I'm getting above 140 over 90, so the key word is I want you to focus on 140, 90. There are different classifications of high blood pressure. I'm not going to go into the details because it's a lot of complicated, newer classification. But I want you to focus on 140, 90. Once your blood pressure is consistently hovering around 140, 90, you are considered someone that has high blood pressure or hypertension. Now, generally, the healthy range of your blood pressure, which you can comfortably say, oh, this person doesn't really have a predisposing factor to high blood pressure, is 130 over 80. So even if you get your blood pressure now and it's hovering around 135 over 80 something, we are worried. So you're warming up to enter the hypertension range. So you should be mindful. You should be cognizant of things you can do to avoid developing hypertension. Now, here's the bigger picture. As of today, there are two types of hypertension. The first one is called primary hypertension or essential hypertension. This is the commonest type of hypertension. Now, as of today, no one knows exactly what causes hypertension from an essential perspective. So essential means it started on its own. We don't know exactly what leads to this, but we have some risk factors. So there are a couple of things that can predispose you to developing hypertension, but no one knows for sure the cause of hypertension in primary or essential hypertension. Now, the other type of hypertension is called secondary hypertension. So secondary means probably some organs in the body, some systems in the body are not working properly. Maybe you had liver failure, maybe you had heart failure, maybe you had kidney failure. Then subsequent to the kidney failure, then subsequent to the heart failure, then subsequent to the liver failure, you develop hypertension. So secondary hypertension is a type of hypertension that will develop when you develop a medical condition. But in primary hypertension, it happens on its own. Nobody knows exactly what led to that. So remember, hypertension is when you have a consistent, over a period of time, your blood pressure higher than 140/90. Now, there's a particular instrument we use in checking the blood pressure. It's called sphygmomanometer. Sphygmomanometer. Don't bite your tongue when you're trying to pronounce it. That's a special type of equipment we use in measuring your blood pressure. We normally put it in your hand, whichever part of the upper limb we choose. Then we measure it carefully. It's important we use the right cuff. It's important we use the right equipment. It's important the heart is on heart level so we can get the right reading. Just measuring someone's blood pressure once and noticing it's high, it's not enough to say that that person has high blood pressure. We need to measure it properly. We need to use the right cuff. So there are age ranges of different types of cuff we can use to measure high blood pressure. If you use the wrong one, it will give you the wrong reading. Now, there are certain things that can make people to have transient high blood pressure. And it wouldn't necessarily mean that you have hypertension. If you don't sleep well, if you have insomnia, the possibility that the systolic, that means the number on top, might be temporarily high, it's there. If you smoke, if you're agitated, if you're coming up from a very hot place, you're in a hot sun, and you enter the clinic, if you check your blood pressure immediately, it's going to be high. So we don't immediately begin to say, oh, this person has high blood pressure because of one reading. That's not how it goes. Now, there are three important factors that will determine your blood pressure. Three important factors. Number one, cardiac output. So the total quantity of blood in your heart that your heart will pump out is called the cardiac output. So the quantity it will pump out. I'm going to come to the other factor. So cardiac output means when that ventricle is contracting to send the blood to the arteries, the quantity of blood that will be pumped out from your heart can, to an extent, determine your blood pressure. So that's your cardiac output. So this is the blood that the ventricles will push out when your heart beats. So anytime your heart is beating, your heart is pumping blood. Your heart is giving blood to the arteries. So that cardiac output is very important. The second factor is the blood volume. So what's the total blood volume in the body? That's the total blood in your body, which is very important. Unfortunately, some people can have some medical condition and the blood volume in their body might not be enough. When you lose a lot of blood, you go into what we call hypovolemic shock and you can die. So if you see people we need to give blood, people that have anemia, we are giving them blood because we need to get oxygen to all parts of the body. Any part of the body that doesn't have oxygen can easily die. So when people have stroke, when people have heart failure, when people have organ failure, why are the organs failing? Because the organ is not receiving blood. What's the function of blood? Distributing oxygen. So someone that has stroke, which is one of the complications in hypertension, simply means the brain did not get enough blood and the brain, for some reasons, began to lose its function. So I've mentioned number one factor, cardiac output, blood volume. Then the third factor is resistance. So when you get to that artery, anything that opposes the flow of blood inside the artery is considered the resistant factor. This can comprise of the flexibility of the artery wall, the diameter of the artery, and the viscosity. So how thick, how fluidy is the blood? So the thicker the blood and the more resistance and the more blood is coming out of your heart, the possibility that your blood pressure is going to go high. So if for some reasons there are medical conditions that affected the integrity of the arteries, so instead of your artery to be elastic, to allow the blood to flow normally, and it's thickened, or he has some clogging, or he lost its elasticity, it can likely lead to high blood pressure. So remember the three factors: cardiac output, your blood volume, and resistance. These are the factors that will determine if you're going to have high blood pressure or hypertension. So if your cardiac output is higher than the artery can contain, if you have high pulling of your blood volume, and if you have high resistance in the arteries, the possibility you're going to develop hypertension is there. Now, hypertension is not something that happens overnight. So why do we say that hypertension is a silent killer? Because so many people, as I'm talking to you right now, they have high blood pressure, but they don't know. So many people do not have symptoms, and there are no classical telltale signs that will tell someone, oh, this person has hypertension. Some people might be carrying blood pressure of 200 over 100. So let me give you a case scenario. You recently stressed yourself, you were looking for money, you traveled, you stayed in the road, very, very angry, not happy, everything is all messing about. Probably you're in Nigeria. I'm in Nigeria, but this is our scenario most times in Nigeria. Now, you didn't know that you have blood pressure. It's been there for 5 years. Now, when eventually it explodes, you can die instantly. So some people can have sudden death. They can have heart attack. They can have stroke. They can have other complications of blood pressure that was not diagnosed on time. So you can go to your village, and you might have had what we call malignant hypertension. So if your high blood pressure is around the neighborhood of 200 over 100, that's what you call malignant hypertension. That means it's a deadly type of hypertension. It can kill you anytime. So the reason why we say that blood pressure, hypertension is silent killer is because it doesn't have symptoms. So some people can have it, and it will be there. It won't give you symptoms. By the time we are noticing it, you've already developed complications. It can damage your liver. It can damage your heart. It can damage your kidneys. Any part of your body that got damaged, that's the end of the story. Once we begin to treat any part of your body, that's a problem. So the best thing to do in any problem, including high blood pressure, including diabetes, is to modify your lifestyle. So remember the difference between the systolic and the diastolic. The systolic is the pressure inside the artery when your heart is contracting and beating. When your heart relaxes, the pressure we get in the arteries when it's relaxing is called the diastolic. Now, I've already told you guys how blood pressure is determined. So the amount of the blood, which is called the cardiac output, the volume, the resistance inside the arteries will determine if your blood pressure is going to be high or normal. Now, over time, by the time your heart is now trying to compensate, by the time the arteries are struggling to make sure they are not messing about, they will damage the wall of the arteries. So if the artery is hardened, the artery will be functioning just like, if you remember, if you have anything standing in your way, you'll be walking more than you normally used to walk. So over time, the high blood pressure can damage the arteries. It can weaken the arteries. Now, when the arteries are weakened, they can have a weak area that will develop what we call aneurysm. So there will be an enlargement in the artery that will lead to aneurysm. Unfortunately, in some people, when the aneurysm bursts open, they can bleed, they can die instantly. So if you have this aneurysm in your brain and it bursts open, you can bleed inside your brain and you can die instantly. Now, sometimes those damaged areas in the arteries will start collecting cholesterol, start building up what we call plaques. Then over time, these plaques can detach, they can block the blood flow, they can cause further damages. So overall, once the arteries are damaged, they can lead to a lot of complications. There are 3 important complications that can happen in hypertension. Number 1 is stroke. When your body is no longer receiving enough oxygen, any part of the body that doesn't receive enough oxygen is going to die. So when you hear about people having stroke, it simply means the body did not receive enough oxygen. And when you don't have enough oxygen, you can't function properly. So stroke is number 1 complication in hypertension. Heart attack. I'm sure you've had so many people that complain, oh, my heart is paining me. And if you happen to be in the village, likelihood is, oh, people in the village gave me jars. So someone in the village was looking for my land. And when I went to the village, I collapsed. So it's possible you're in the village for Christmas and you probably have undiagnosed hypertension or poorly managed hypertension, and your lifestyle is not helping you to control it. You can have heart attack. Some people can develop kidney problems. Some people can develop liver problems. Once your blood pressure is not controlled, it can kill you silently. So if your dad had hypertension, if your mom had hypertension, if your sibling have hypertension, please be careful, be mindful. Now, if we eventually kind of have an inkling that you're developing hypertension, we don't immediately rush to start giving you medications. So medication is not the first line of treatment in hypertension. We have to look at your lifestyle. So lifestyle modification, it's number one. I'm going to mention a couple of things you need to do. Number one, you have to eat healthy. Now, this is Christmas period. The possibility you're going to eat a lot of food, things you haven't really eaten. You go to parties, you go to functions, you eat nonsense out there. If you really genuinely want to prevent hypertension, you have to be mindful of what you eat. So lifestyle modification, number one, is what? Healthy diet. Now, be mindful of your intake of salt. Salt is one of those things that will retain water. So if you are already predisposed to high blood pressure, when you take a lot of food that contain a lot of salt, they will retain water. When your body is retaining water, your body will be accumulating a lot of blood volume. When you have a lot of blood volume, you have a lot of cardiac output. When you have a lot of cardiac output, it's going to put more pressure on the arteries. So people that eat a lot of food that has a lot of salt, reduce your salt intake. Your salt contains sodium. Sodium is one of the substances that retains fluid in the body. That's why some of the antihypertensive medications will give you to remove salt from your body. So mind your intake of salt. Very, very important. Now, limit your consumption of highly processed food. So in this era of takeaway, burger, cake, this, fry that, limit them. The more of those highly processed foods you're taking, you don't know what they use in preparing it. So limit them. Eat more food organically you prepared by yourself. When you do that, you're giving yourself a chance. Now, if it's possible, which I know is possible, avoid alcohol or limit your consumption of alcohol. I know it's difficult to do this, especially about this festive period. You know, you bought alcohol, you brought beer, you bought wine, and you'll be wondering, so who's going to drink all this wine? What does this guy even know what he's talking about? But please, if you can, if you have a predisposition for hypertension, limit your consumption of alcohol or stop it completely. Definitely, you don't have any business smoking. Remember that when we talk about smoking, there are two different types of smoking. You can be smoking primarily if you light a cigarette and you smoke it by yourself. But when you hang around people that smoke, you are also smoking. It's called secondary smoking. So no smoking, both primary and secondary smoking. Now you must exercise. There is absolutely no way you want to drop your risk factor of developing hypertension without exercising. Exercise is huge. When you exercise, when you eat good food, when you don't drink alcohol, when you don't smoke, what's going to be the outcome? Your body mass index, which is an index we use in checking if you are overweight, if you are obese, if you are underweight, it's going to be normal. So when you exercise and you eat more fruits and vegetables and you drink more water and you don't consume more alcohol and you sleep properly, the possibility your blood pressure is going to be that of a baby is high. But regular exercise, there is absolutely no way you can avoid this. And when we talk about exercise, you don't necessarily need to go to the gym to be jumping up and down. You can go for a walk. Just 30 minutes out of 24 hours in the day, go for regular exercise. When you lose those excessive body weight, you are helping yourself to maintain a good blood pressure. Now, in the event you've done all this and there is still need for you to go for medications, there are a couple of medications that are completely used in treating hypertension. Some of the medications can work on your kidneys, some of them can work on the blood vessels, and some of them can work on your heart to reduce blood pressure. An important and commonly used medication for treatment of hypertension is what we call diuretics. So it's also called water pill. So when you take diuretics, it makes your kidneys to remove a lot of salt and water. And when it's removing water and salt from your kidneys, it's also removing it from your blood. When that happens, it's going to reduce your blood volume and your blood pressure. Now, there are also some medications we call beta blockers. Beta blockers will reduce the workload in your heart, will reduce the rate of your heart beating, and in course of doing that, will strengthen your contractions. Some other people will also take some drugs directly that will relax the blood vessels. So if you notice, there are some drugs we can give you that can work on the kidneys. There are some drugs we can give you that can work on the blood vessels. There are some drugs we can give you that can work on the heart. So any of those components can help you to reduce your blood pressure. Now, there are classifications of drugs for blood pressure. A type of them is what we call ACE inhibitors. There's another classification we call the angiotensin II receptor blockers. Then we also have the type we call calcium channel blockers. Don't worry about all these drugs. The most important thing for you to do is to modify your lifestyle. Then you meet your doctor. Now, how will you know you have high blood pressure if you don't form the habit of seeing a doctor? You know, over there in Nigeria, people brag, oh, I haven't gone to the hospital. I don't normally get sick. Maybe once in a while I treat malaria. That's not good. Every adult should form the habit of seeing their doctor every single year. So it's not only women that go for their well woman check. So if you haven't checked your blood pressure for the past 1 month, you're not doing the right things. If your blood pressure is not within the normal range, if you haven't checked it, I encourage you to go out there, look for a very good place, make sure your blood pressure is checked appropriately. If you can do this, you are in course of making sure you're living healthy. Okay, so that's my presentation this evening. I normally give opportunity for people to ask questions. So if you're in attendance in this clinic this evening, please feel free to ask me questions. This is the reality about hypertension. So there is no such nonsense like I was thinking too much, or because you don't have to think in the past, or those nonsense. They are not the reason why you have hypertension. We don't know. If your parents develop hypertension, they did not develop hypertension because you refused to marry who they wanted you to marry. That's not the reason why they develop hypertension. If it's essential hypertension, no one knows about the exact cause, but we know about the predisposing factors. So please, if you have questions in the next 4 minutes, I will give you opportunity to ask your questions in real time. So I'm going to hang around. If not, after this, I'm going to share my transcript. Please, if today is the first day of attending my clinic, we normally run this clinic every Tuesdays about this time. So Tuesdays, it's about 6 p.m. or 7 p.m. Eastern time. Unfortunately, people in Nigeria will be sleeping by then, but that's about the time I will be free to come live. So if you're not able to participate in real time, when you wake up in the morning, I always share it on different platforms. But on Saturdays, I come in a little bit early. So Saturday, 6 p.m. Nigerian time, 12 p.m. Eastern time, US. Make sure you subscribe, make sure you like, make sure you comment. It's really a broad topic. We can't exhaust everything about hypertension in one clinic, but I've tried my best, and now I'm ready to take care of your questions. So please, if you have any questions, ask in real time, and I'll provide you feedbacks in real time. Do you have any questions? This is a very important topic, especially about this period. So if you haven't measured your blood pressure, please go and check your blood pressure. If it's 140/90 consistently, go and see a doctor. They will not start you immediately with medications. They will tell you to lose your body weight. They will tell you to eat healthy. They will tell you to exercise. Now, over time, when they check all those stuff and your blood pressure is still high, they can now start you on some medications. Please don't start any medication by yourself. Don't stop any medication by yourself. Always consult with your doctor. There are no local herbs that will end your blood pressure. Unfortunately, when you have hypertension, it's one of those things you will have for the rest of your life. So it's a chronic condition, just like diabetes. It's not permanently cured, but we can manage it appropriately and you can still live a normal life. High blood pressure can affect any aspect of your life, including your sexual health. There are some men that have erectile dysfunction today because of poorly controlled hypertension. And unfortunately, hypertension in some people will come with so many of their brothers and sisters. So majority of people that have hypertension will also have diabetes. And in course of doing that, they can also develop cholesterol problem. When you have a combination of hypertension, diabetes, cholesterol, and obesity, it's called syndrome X. Very deadly combo. You don't want to have this. Can blood pressure be cured? That's a very important question. Unfortunately, it's not permanently cured, but it can be managed. Once you develop it, it's one of those conditions we call chronic condition. So we're going to manage it until you die. So anybody selling you any dummy out there, oh, take this and it's going to cure it permanently, is deceiving you. If you live healthy, if you take your medications properly, if you modify your lifestyle, you can reduce your risk factor. So once you get yourself to a normal level, the key word is maintenance. So if you're able to control your body weight, which over time from research, we discover that when you control your body weight, your blood pressure is going to drop, your blood sugar is going to drop. If you can maintain yourself in a normal BMI, then the key word is sustenance. But you cannot cure hypertension permanently. You have to manage it until you die. The same thing is applied to diabetes, to asthma. So any chronic condition you have out there, it's not permanently cured. Okay? So that's the only question I have. And if you don't have any other question, then I'm going to end the clinic. The next clinic, hopefully, it's coinciding on Christmas Day. So I know so many of you will be busy on Christmas Day, but we can see how things, pan out. And if we have one or few minutes, we can always pop in and, share one or few things. But this is a period you need to be careful. Now, officially in our group, SGHS, No Spirations, Global Health Solutions, today was our last official clinic. So from today till 31st, which is our big event, remember 31st is our crossover clinic. So that's the next clinic we're going to have. So officially, the SGHS crew, the admin, is going to be on a relaxed mode. So it doesn't mean I'm still not going to be out doing one or few things, but officially our clinics ended today. So from tomorrow, we're going to have just, behind the scenes, overlooking the group. If need be, I have to come in and say one or few things. I will say one or few things. But officially, the clinics on Wednesdays, Tuesdays, Thursdays, Fridays, and Sundays will now be suspended until the 31st. 31st is a very big open clinic. It's going to be our crossover clinic. You do not want to miss that clinic. Okay, so make sure you attend the clinic on 31st. Okay, I have another question. Your at-home blood pressure sometimes varies greatly. Correct. So it's important you measure your blood pressure exactly about the same time. I normally tell my clients to measure it first thing in the morning. So if you measured it first time in the morning, make sure you measure it exactly at that same time. Now, it's also important you measure your blood pressure at heart level. Some people put the cuff carelessly, put their cuff, tighten it, or make it so loose. When you do that, you're going to get different readings. Now, the blood pressure your doctor will measure in the hospital with his own blood pressure kit, it's more reliable. Now, listen to me carefully. The mind is just a complex thing. Some people can develop white coat transient blood pressure. So some people can use their blood measurement kit at home. Blood pressure is good. Once they step into the clinic, because of the anxiety, because of the fear of seeing doctor with a white coat, they will develop transient high blood pressure. So there are some people that will develop high blood pressure when they go to the hospital. When they come back, their blood pressure is completely normal. So there are so many complex things that play a role in the reading. Now, but here's the deal. If you are consistently getting about 140, 90, 140, 85, then maybe you get another 139 over 80. It's hovering around that. It's never really gone to 110 or 120. You probably have a high blood pressure. So if we find the average, when you go to your doctor to measure properly, possibility you have high blood pressure is high. Now, what I will tell you is this. If you're in a developed country, like if you happen to be in a place where they have public place you can go to check your blood pressure, like in America, you can always go to Walmart, Publix, and a couple of other pharmaceutical outlets out there. You can combine your reading with the reading you will get there. So you can walk into any of those pharmaceutical shops and a professional can check it for you. So let me give you an example. If the blood pressure you got at home was 130 over 80, then you check with your doctor, and your doctor is probably getting about, 135. You need to be careful because remember, once you're getting to 130, 80, we need to be careful. Though blood pressure, high blood pressure is classified as sustained 140/90, but there are different mini classifications of high blood pressure, which I'm not going to go into details. But I just want you generally to focus on making sure that your numbers are not more than 130/80. If your numbers can be below 130/80, you will make me happy. So the key word is not to make it below 140/90. The key word is to make sure it's not higher than 130/80. 130/80, that's the new classification. So if you notice some variations when you measure at home and when you go to your doctor's hospital, just take the average. Now, if you notice that when you go to your doctor's office, it's very high, then when you come back, it's normal, you have white coat blood pressure syndrome. It happens. Okay? All right. So do we have any other question from the audience? If we don't, then we're going to call it a day. I want to use this opportunity to thank you guys for making this a beautiful journey. I love my community. I love teaching at any opportunity. Without you guys, there won't be this channel. So thank you so much for your support. Thank you for giving me that opportunity to share my knowledge. I truly appreciate you. I hope things I've shared has helped you to know better, to do better. So this Christmas period, be careful. 2021 was challenging, but we thank God we are still standing. So make sure you're mindful of what you do on a daily basis. Now, if you're probably in that neighborhood of someone looking for a baby, remember, you can have your babies. You can have 2, you can have 3, you can have 4. Just remember to always pray. Remember to always play. Playing means making love with your partner and practicing. This is a very tempting period. You might likely go to a place people will query you, ask you questions, make you uncomfortable. Don't allow anybody make you uncomfortable. If you're not comfortable in your environment, change. If you don't feel comfortable traveling home, don't travel home. Be in a place where you're valued. Be in a place where you're loved, because all these things can add up. If you've been having consistent insomnia, that means you're not sleeping, and you notice this terrible headache, please go check your blood pressure. It's possible you predispose yourself to developing high blood pressure. Okay, so thank you for coming this evening. I appreciate you. And like I said, I don't know, probably I will see you guys again on Saturday, but whatever happens, I'm going to communicate. If need be, I have to shoot a small video, I will do that. But please remember to subscribe. Remember to practice everything we'll be teaching you. And please remember you matter. Okay, so God bless you and enjoy your Christmas. Merry Christmas and have a beautiful, prosperous 2022. I'll see you guys again. Bye-bye for now.